So this is a photograph of Lee, who also worked the storm, and I don't think the man stopped working since August 27th. He has not stopped a single day. And here he is on a conference call on the USS Comfort. We were both on the same call, but we were taking it from different phones. That's his office, he always says, in his hand is BlackBerry. That's been his office since the storm. And he, again, like Ebony, he's a nephrologist, so he typically likes things to be in a certain way, but boy, he just really was able to think out of the box and be flexible with what his responsibilities were. This is the Comfort, where within a matter of a couple of days he let us sort of figure out how we'd have a training program, how we could sort of put folks in there. He's a real hands-off boss. It's pretty great. He also has a lot of strength, but I didn't put him there. This is Jeanette's house, just about. It's probably a lot of y'all's houses.
Well,
I don't know.
Not mine particularly.
So the strength piece is, my reflections about that are personally, for example, we were very unscathed, my husband and I. And the post-storm period was relatively very easy for us. We don't have children. We didn't flood, barely had any wind damage. We have a small house that he was able to fix everything, so we didn't need to wait for contractors. And then there was a lot of other folks who had this. And about a third of my faculty had that. Many others in the Department of Medicine, and Banji, much worse than this actually, who's speaking next time. And I don't know the answer to this yet. I'm 8 months out, and I don't know exactly. I haven't figured out what I want to say about this entirely, but just to say that I'm amazed at how much strength people had in this storm period. That people who, this is what happened to their lives, kept working without interruption, pretty much, and just kept focused on what it was that they were trained to do, whether it was public health or clinical care or training the next generation of physicians or doing the research. Whatever it was, they just kept really focused on mission, keeping programs together. And when this is going to fall apart for us, I'm not 100% sure. It may have already, and it's so subtle we don't know. But the strength that I witnessed in people was really tremendous, and it still is. How you prepare for yourself for that, aside from like Prozac, I don't really know what to tell you. But I'm thinking we should put it in the water before June 1st because we're all going to really lose it. Juliet's one of these people who lost everything. Juliet Saucy's the head of EMS. She's an ER physician. She's the New Orleans emergency medical director. And she worked pretty continuously as well, moved her kids to Dallas, and is from a pure, true, emergency preparedness, public health, one of the finest people that you'll ever meet. Y'all should have her come speak about her experiences, because she is a really strong person who completely unflappable and able to sort of stay focused on the task no matter what. I think this is what was hardest for most people, was to make decisions with very little data, especially in the academic environment. So we're typically very accustomed, especially if we're investigators or clinicians, we like to have a lot of information at our fingertips. And that's why people like Juliet, for example, or James Moises, or Keith Van Meter, or even my husband, they do well because they're ER physicians. And I think their training allows them to make decisions with very little data. That's what they're used to doing. Internists, not so used to that. We like to have a lot of information at our fingertips. And researchers, same sort of thing. They like to have the whole thing painted. And it just wasn't possible. For example, just a gross example of how you may have to make a decision without all the data available, back to the USS Comfort. So the Comfort was here for 10 days, and we were on it. And one of my faculty, by the way, the faculty were fighting to work on the ship. It was like the best gig in town because they had air conditioning and food and big plasma screen TV, and everyone was in a good mood, and they had internet. But anyway, so Happy went to work her shift that night, and they said, we're heading out in the morning, so we're closing up, so you can't work. So she called me and said, I just want you to know the ship's definitely leaving. They sent me home because they're packing up. And this was a big controversy because there was a group that wanted to keep the ship there so we'd have some semblance of a charity hospital, and there was a group that didn't want the ship there because it was distracting and interfering with us opening real hospitals and not using those resources for, I mean, the ship's a real hospital, but a brick and mortar hospital that we have in our city, and keeping staff from being able to work there. So the next morning I was on a call, and Saturday morning, and on the call, one of our pulmonologists said, I said something about the ship was leaving that morning, and he said, oh, no, you're completely wrong, the ship is staying. And I know that for a fact, and I was like, okay. And then I got on a call at 11, this planning meeting with the whole state folks, and the charity hospital people in Baton Rouge were on the phone, and they said, yeah, we're talking to the ship about staying, and we think they're going to stay for another few weeks, and blah, blah, blah. So I sent one of our chief residents down to the dock, and just had him just drive. I said, just go down there and tell me if the ship is there. So he drove down there, and he stood on the dock, and he called me. He's like, the ship is gone. And I was like, okay, thank you. Now, of course, I didn't see it with my own eyes, but I trusted Jay, and I knew the ship was gone. But that's about how crazy the whole world was, and we were all trying to make decisions. Sometimes the data we had was flat out wrong. Sometimes it was only partial. But you really have to be able to do that, and you have to be comfortable. The thing you have to be comfortable with is making a mistake, because you're going to make a lot of mistakes. You're going to say the ship is gone and the ship's actually there, and you have to go, oh well, and move on. Right? Your ego has to be pretty well intact. Oh, and like this guy, oh, I don't know, let's just give him some fluids and see what happens. Clinically, you're just sort of stabbing in the dark. This is a decision that Scott made with very little data. Scott Cowan made a lot of decisions with very little data, and some of them very positive for us. This is a building that he gave us on the Uptown campus to see patients in, just because we thought we were going to need space. We didn't know how much use it would get. He said, fine, whatever, clean it out, it's done, within about 5 minutes. He didn't ask us for a business plan and the whole thing. It was really a remarkable gift, which we had to close it down to save another spot we had. My last quality is vision. And, I think the vision helps people get through the really bad times and the chaos. It I think is the thing that keeps people strong and able to look to the end of the tunnel. Although Lee Ham has an expression, he says, some cartoon he has that says, due to budget cuts, the light at the end of the tunnel has been turned off. And I mean, there are really some days like that where it was so bad, you're just like, God, there's no way out of this. Everyone's, but there are a couple of things that I want to mention in particular, or entities. One of them is HCA. And I probably would say this to Mel Lagarde's face, so I'll say it to y'all. I would have been the last person before the storm who would have said something nice about HCA, my talk about leadership after the storm. But this organization...
You have to say what HCA is.
Oh, I'm sorry. HCA is Healthcare Corporation of America. It's a for-profit company that owns 80% of Tulane Hospital. So they're our for-profit partner, so we have a public partner, a charity, the VA, the Veterans Administration, and then we have HCA. And their mission, because they're a for-profit healthcare corporation, is to, what's their mission? Make money, that's right. And what's our mission in academia? To hemorrhage money. It's to build new knowledge, right? It's to bring the next generation along. It's a lot of things, but it's not to make money. And so we're often at odds with them. During the storm, by all accounts, that organization functioned very much like the military. They had clear roles and responsibilities. They had a clear hierarchy. They had resources at their disposal, so they could call in the helicopters, call in the satellite phones, something other hospitals didn't really have access to. After the storm, probably because of their deep pockets and their great insurance, they kept that vision that they were going to be open. And I have to tell you that there were days when that was all we had to hang on to. I hate to tell the residents in the room that. But even to this day, none of our other training partners have their hospitals open, not our VA and not charity. So the only training place that we have for our students and residents is with this for-profit partner, who's opened their doors at their Metairie Hospital and at Lakeview on the North Shore to accommodate residents for training. So money does bring generosity. There's no doubt about it, and I think that's a huge piece of it. There's they're coming from a very strong position. It's easy for them to be generous, but there's some organizational things I think you can learn from them. Contrast that, for example, with the VA hospital, which also has clear roles and responsibilities, a strong hierarchy, and theoretically should have resources. But there's clearly some organizational differences in their ability to function both during and after the storm. My personal opinion, from knowing the characters in both places, is it has something to do with these individuals and their ability to set aside their personal wishes and needs for the greater good of the organization. And I didn't really necessarily see that in other organizations. Their culture of their organization is very much about pushing forward that corporation, for good or for bad.